major warning sign of dementia is memory loss. That's probably what people, if they forget something very simple, they might say, oh my gosh, I have dementia. And I'm going to be using the term dementia a lot. And the reason why I'm using the term dementia is because it's an umbrella term. I'm not saying somebody has Alzheimer's. I'm not saying somebody has had strokes. I'm not saying somebody has had other brain injuries. I'm trying to make it general. So dementia is a term that we use. It means that there are some symptoms that the person is having. The disease, the cause of those symptoms, that's where Alzheimer's or Parkinson or strokes or brain injuries come in. So dementia is just a nice way for us to have a general term for our discussions. If any of you would like to talk about some of those causes, they're not included in this presentation, but I certainly can have those conversations with you. So here is the first common sign of memory loss that might disrupt your daily life. So each of these slides is going to talk about what's normal and what is possibly a cause for concern. So here is sort of a statement. One of the most common signs of Alzheimer's is memory loss. And again, I would substitute the word Alzheimer's with the word dementia because a lot of different causes will give you dementia. And so it's a memory loss which is especially forgetting recently learned information. So that word recently is key. Recently means it's short-term memory loss. There are very interesting things about our memory in our brain. Short-term is stored in one place and long-term memory is stored in another. So the person with dementia, again, they might have Alzheimer's as their cause. That is primarily going to cause us to remember recently or things in the short term. So that's why it makes that distinction. Others include forgetting important dates or events, asking for the same information over and over, increasingly needing to rely upon memory aids. We call memory aids things like our phones or our calendars or writing things down. Maybe family members have started to notice that that person is having problems for remembering and they're forgetting more often, and so the family members might be filling in and being their memory and cueing them and saying, don't you remember we talked about that? Or yes, you do have a doctor's appointment next week. So the family members might be doing that assistance for them. Now, that is something that is a possibility for concern, to find that memories and not being able to remember things are progressively becoming worse. But a typical age-related symptom is just maybe forgetting names and appointments. Maybe you remember them later on. So here's sort of a general thing that we say in our classes. Regular age-related forgetting things is maybe forgetting where you put the keys. Maybe you don't have a spot in your home where you put the keys every time you come home. But Alzheimer's / dementia-related concern is when you look at the key and forget what it's meant for. That's more what I'm talking about. Somebody that's looking at a household item, something they use in their daily life, and all of a sudden they can't remember what that is for. That's reason for concern, and that is something that we want to then bring to the attention of the physician, the neurologist, not necessarily, oh my gosh, I forgot about that doctor's appointment. We get a lot of information in our daily lives, and if we forget something every once in a while, it is definitely not for concern. Any questions about that? I'm so sorry about that. Can everyone hear me? Okay, wonderful. So that's the first type of thing to look for, is short-term memory loss. The second thing is challenges in planning or solving problems. And I'll just read the first statement, which is, some people may experience changes in their abilities to develop and follow a plan or work with numbers. A typical example would be doing the bills, working on a spreadsheet. Those types of things may become more difficult if somebody has dementia or has some brain condition. They may have trouble following a familiar recipe. They might have had that recipe passed down generations and they could do it no problem, and all of a sudden now they're having issues with it. They may have difficulty concentrating, or it may take much longer for them to do tasks that used to take a very short amount of time. So those are the types of things that we're going to be looking for. And this is where we start talking about cognitive impairment. If somebody has dementia, they will increasingly have issues with their cognitive impairment. So that means their thinking ability. And that's what really all of these 10 things that we're looking at is what is affecting that person to be able to function in their daily life. Definitely short-term memory loss, and definitely having problems with planning or solving problems. Now, again, the opposite, which is a typical age-related change, is maybe having trouble balancing your checkbook. That would be a normal thing. Maybe not being able to necessarily, let's say, configure the computer when there's an upgrade. Those types of things. Maybe the phone had an upgrade in the middle of the night, and as a result, we weren't able to maybe use the phone as adequately. Those are normal age-related. That's no reason for concern. The third thing that we want to focus on is the person may have difficulty doing familiar tasks. So these are things that could be in the home. Well, let's read through the first sentence here. People with Alzheimer's, and again, or related dementia, may find it hard to complete daily tasks. It might be making the coffee. Maybe it's brushing their teeth, things that might have a sequence of steps. They may have trouble driving to a familiar location. We hear this a lot in our discussions with families, is that the person that is developing cognitive impairment, they might go to the grocery store where they went every week for the past 15, 20 years, and all of a sudden, for one reason, one day, they might get lost on the way there, on the way back. This is why when people do have cognitive impairment issues like dementia, we want to be aware of it, and we want to have a discussion with the families in terms of driving. Driving is a huge risk if we allow the person with dementia to continue to drive. Maybe they're managing budgets at work, or maybe they're playing a favorite game. Could be a card game, could be a board game. If they're having issues trying to remember either what's higher in terms of winning a particular hand, they can't play bridge anymore, those types of things, that might be of concern. What's irregular age-related is that we may occasionally have issues with the settings of a microwave or the settings of recording a television show. Those things, they can be irritating, they could be frustrating for just about anyone. I know in the old days, we used to be able to record onto VCR tapes, and now I do it all through, just the remote control. So there are some things that have gotten a little bit more complicated with technology. Those are normal. Being able to maybe not program the microwave. We just had this daylight savings time, so all of your clocks might be, the wrong time until you update the settings. So those are normal things. But the more major things are when you're forgetting some things that you've done most of the time you've lived in your home. Confusion with time or place. Now this one is very interesting, and it goes back to what I was saying with the way that your brain stores memory. So it says people with Alzheimer's, again, or related dementia, can lose track of dates, seasons, or the passage of time. They may have trouble understanding something if it's not happening, immediately. Sometimes they may forget where they are or how they got there. So this goes back to short-term memory. If this person is needing to maybe drive someplace, or they're going on a walk into their neighborhood, they might not remember because it's something that they've learned within the past weeks or months or years. The thing is that they are very able to bring up and to recall long-term episodes, long-term events. A little background now. Yeah. So this leads to an interesting happening in the family. Let's say that I'm 80 years old, and let's say that I am married and I have dementia. If I look at my husband, who's also 80 years old, but I'm going back in time, remembering when I was younger, and those younger memories are more current for me, I might look at that 80-year-old person and say, they're not my husband. I'm not 80. I'm in my 20s. I'm in my 30s. So we have this very strange thing that might happen where people that are in a family, maybe even married to each other, will not be able to have that same sort of communications or that same kind of relationship because they themselves think they're younger than they actually are. So that's a very strange sort of side effect of the short-term memory versus the long-term memory. When it comes to losing track of dates, it might be a doctor's appointment. It might be something that is more current, but probably that person, even if they have dementia, they can remember dates that they've known for a long time, like their birthdays or their mother's or father's birthdays. So it's almost as if they remain in that time. Now, if you happen to, this is a side note, if you happen to be in this situation where you know somebody with dementia and they are doing this, what's not helpful is telling them things like, don't you remember? I told you that. We just discussed that. What's better is to follow them into their memories and bring up things that they might be actively having in their memories, like, hey, you used to have that cool car when you were in your 20s. Tell me about that. Or, oh, what was your favorite vacation when you were growing up? So we call it reminiscing. And it's something that you can do with the person with dementia when it comes to sort of meeting them at the level where they're at. They might not be necessarily as in touch with the day-to-day reality, but they most probably will remember the past in very much active, and they might be able to tell you some wonderful stories. Now, that's the person with dementia / Alzheimer's. What's typically age-related? My father is 90 years old, and he gets confused about the day of the week, mostly because he doesn't go to work anymore, and he doesn't have, that kind of a schedule. And he gets confused about it, but he'll figure it out. That's normal. Those are the types of things we wouldn't be concerned about, especially when we have, let's say, we have a lot going on in our lives. Is it really Tuesday? Is it really Wednesday? If you don't have a set schedule, then that might be something that throws you off. So definitely forgetting about what day of the week is not of concern. Trouble understanding visual image and spatial relationships. This has to do with the eyes. What we're finding is people with some type of a brain issue, whether it's Alzheimer's, whether it's a head injury, stroke, their vision is affected, and that means very often that they have depth perception issues.
They might very well be a little hesitant when they're walking because they don't want to fall, they don't want to trip, and so they're looking down quite a bit to make sure that they're not going to run into something. They may also have difficulty reading, again with the vision, judging distance, determining color or contrast. And the other thing that is prominent with somebody with cognitive impairment, dementia, is that they don't have any peripheral vision. So that's an issue here. If I'm looking straight ahead and somebody starts to talk to me and they're out of my vision, they're maybe behind me, or maybe they're even worse, in another room, and I don't know that they're talking to me. I might be startled when suddenly, they appear in front of me. So we have some wonderful handouts that I'm going to give you, which is things that you can do when you are trying to communicate with a person with dementia. And one of them is to come around to the front, to be able to talk to them, get their attention, use simple, soft language, and that will help with our communication. So those are things that if you notice somebody having those types of issues, it might be indicative of them having some cognitive issues. What's typical age-related? We all know these: cataracts, maybe getting more intense glasses. That might be something, but definitely not the types of issues when it comes to spatial relationships. Depth perception isn't necessarily an old age. So we try to make that distinction, although when we get older we do have issues with our vision. This is an interesting feature of dementia because it has to do with language comprehension. People with Alzheimer's may have trouble following or joining a conversation. They may stop in the middle of the conversation and have no idea how to continue, or they may repeat themselves. They may struggle with vocabulary, have problems finding the right words, or call things by the wrong name. Maybe they substitute the word they're trying to find with a word like, oh, that thingy, or that what's his called. So this is, again, something to do with cognitive and where your memories are stored. Language, if you've never studied language, it's a very complicated feature of our brains. The brain has to do multiple things. First of all, I have to hear what somebody is saying. Then I need to interpret their words and try to figure out what those words meant. And then when I need to respond to that person, I then need to find the right words, which are then going to make sense in my response. So language is a very highly defined and highly skilled types of features that we have. And when the brain is not functioning at 100%, it causes issues with language. A lot of times we say to families that are taking care of somebody with dementia that they should speak slower, make sure the person is actually being able to catch up, maybe using simpler, shorter sentences. If they're trying to give the person options, let's say a menu, or clothes to wear, we might only give them 2 options and not 15 of them. So we're just trying to make it a little simpler. What's typical age-related? Well, obviously, we all do it. Not finding the right word. That's typical. That singer, that one that, was in that, and those are typical things. There's a lot of reasons for that, one of them being information overload. But there's also something that Ms. Courtney and we teach, and it's a lovely class called Total Memory Workout. I'm going to do my little commercial here. This is a 4-week class, and Total Memory Workout helps your memory. And the reason why people usually forget words or forget names is really because they weren't paying attention the first time when somebody said their name, when somebody was introduced. We're introduced to 15 people all at once, we're not going to remember. So this class, this 4-week free class that we teach, is coming up again in May. So I'm going to leave these brochures about that class. It's kind of fun. You'll learn a lot about your memory, but that is definitely very typical for age-related, is not remembering a word, not remembering a name. That is no cause for any alarm. So, misplacing things or losing the ability to retrace steps. How many of us have walked into a room and all of a sudden we stand there? Oh, what was I doing? And then we walk back out. Sometimes it works. You walk back out and say, okay, what was I doing here? That's normal. That is not a reason for concern. A person with Alzheimer's or related dementia, what they might do is put things back in unusual places. They might hoard items, which means they're hiding them. It could be things like jewelry or parts of clothing, but it could also be food. You know, that's of concern. They may lose things and be unable to go back over their steps to find them. They literally have no idea what they were just doing, and that has to do with short-term memory loss. You know, they were going through a day and all of a sudden it's like, oh, what was I doing? Or what was my plan for today? Sometimes they may accuse others of stealing. We see that a lot in assisted living and memory care facilities, that people are, you know, putting something in a certain place, but they've forgotten where they put it, and all of a sudden they think somebody stole it. Typically, it hasn't been stolen, they've just forgotten. The thing about this particular trait for somebody with Alzheimer's or related dementia is that it's happening more and more. This anxiety that they have because they think somebody's stealing from them is going to continue, because their short-term memory is going to get smaller and smaller and smaller. There's a lot of books that we have at our main location, which is right down the street, and there's a book written by a gentleman that is losing his ability to think. He actually is losing his ability to find things, and he says, imagine that it is like you get up in the morning and you plan your day, and you've got 5 or 6 things that you want to do that day, and you start to go out into your day and you start to, and then he said it's as if a piece of eraser, you know, just swept through and just erased everything that he was planning on doing. That's what we're talking about. That is a very severe type of thing that's happening. Just forgetting or misplacing things from time to time is not a matter for concern. So you can see the difference between just forgetting versus not being able to, you know, live independently, not being able to live and remember things. So misplacing things from time to time, having to walk into a room and say, okay, what was I doing? Walking back out, that's very typical and is no matter for concern. Decreased or poor judgment. So let's talk about that. People with Alzheimer's may experience changes in judgment or decision making. Maybe they're becoming more impulsive in terms of spending, in terms of buying things. They may give large amounts of money to telemarketers, or even worse, scam artists. They're not able to make those decisions of, wait a minute, this is definitely not an up and up type of offer. And as a result, it could very well be that they get swindled. And that is a concern, of course. We want to make sure that that doesn't happen. They may pay less attention to grooming. So you start to notice that they might become a little bit disheveled. Maybe they're not showering as much. Maybe they're not, you know, changing their clothes. And it has all to do with decreased or poor judgment. They are not remembering some of these very basic things that we typically do, which is, you know, put on new clothes, get dressed, groom our hair. So this is definitely something to watch out for. What's a typical age-related change? Making a bad decision every once in a while. Usually, you know, we might buy something or decide something. Those are things that are normal, everyday events. those are not of concern. What's of concern is if they are not able to make any logical decisions. This is probably pretty now advanced. If the person has dementia or Alzheimer's, a person may start to remove themselves, which means they're no longer interested in daily events. Maybe they used to go out and play cards with a group of friends, and now they really don't want to. They may have trouble keeping up with a favorite sports team, and they might forget how to complete a favorite hobby. Maybe they used to play, sports, maybe they did pickleball, maybe they did something else. They may also avoid being social because of the changes that they're experiencing. They realize that they're not able to remember the rules. That definitely would be of concern. And what's typical, that they might, as age-related change, they might be weary of work, of family. They might need a little bit more downtime, and they might not want to participate as much. Changes in mood and personality. This could be pretty pronounced if somebody has dementia or Alzheimer's. The moods and personalities of people with Alzheimer's, again, dementia, may change. They can become confused, suspicious, depressed, fearful, or anxious. These behaviors are, again, because their brain is changing, it's actually affecting their personality. And sometimes that can become quite alarming to their family or to the people around them if they become paranoid. Maybe they have hallucinations, seeing things. They could be easily upset at home, at work, with friends. And once these types of symptoms have started to happen for somebody with Alzheimer's or any related dementias, this is when we definitely want to talk to the families. We want to make sure everybody's still safe in the home, including the person with dementia. So this is where it's become now an issue of the person's behavior. Maybe they're more confrontative. Maybe they might be assaulting someone. That's definitely a matter of concern. And what's age-related? Developing very specific ways of doing things. I wouldn't say we were used to doing things a certain way, but as we get older, that's probably kind of typical. I like to eat my spaghetti this way, and this is how I like to eat it. Those types of things. I only drive on this side. So those are type of things that might be just age-related, and the person might become irritable if they're not able to do that. My father likes to go to certain restaurants, and if they don't have the menu item that he's interested in, he gets a little, irritated. And I'm like, well, what are you going to do, Dad? So those are normal things. But these other personality or behaviors are definitely of concern. So, as a review, we have a little chart here, signs of Alzheimer's dementia, and then typical age-related changes. You can see that it's pretty drastic from one side to the other, so hopefully you can place yourself in the right-hand side when it comes to what you might be going through. So, here's the question: what if you do notice these signs? There's a few things I wanted to talk about. One of them is if you are concerned with your own memory, it might be that you do something that we provide. It's free. It's called a memory screening. And if any of you have been through our memory screening, it's a nice, free, 30-minute way to be able to, I gave enough here for them, if you could pass one down, to be able to, sorry camera person, didn't mean to move on you. Sorry. Oops, you need more. So this memory screening gives you, in 30 minutes, just a baseline. And basically what it's doing here, there's too many, but go ahead, pass it up. And it gives you, in 30 minutes, here you go, the number between 1 and 30, and it's a standard test. It's a test that is known throughout the country. It's not just our test. But that could be a way that you just eliminate that concern in yourself of what your baseline is. After this memory screening, you'll get a number, again, between 1 and 30. And as a result, what you might want to do is take it every 6 months or take it every year. You know, we provide it free, so there's no downside to this. But then you can compare yourself and be able to do a little regulation. The other thing that you can do is schedule an appointment with your doctor. The type of doctor that you would probably go to if you think you do have some of these 10 symptoms would be a neurologist. The neurologist would do more extensive testing. They might even do scans or things, and so that's usually logically the second step. But we do know that people with Alzheimer's, with dementia, with any type of these cognitive impairments, they have good days and bad days. So they can still function to a certain point within the family or within society, but it's confusing to us to be associated with them because sometimes they're more like they used to be and sometimes they're not. Be prepared that there might be difficult situations when you're interacting with somebody with dementia. Again, this whole repeating the question over and over, that repetition, it might become, not horrible, but it might become annoying for the person that's in the family. One of the things that we recommend is in that last bullet, which is be flexible, be patient, be understanding. If you do come across, we have this lovely brochure here, and this is always, always, always. I'm going to put it back by the door if you think you might need this. It's a reminder to not try to use logic when talking with that person. It's more that you agree with them. Sure, the sky is purple today. Yep, you're right. And it doesn't matter at this point if they are having these cognitive issues. You don't have to be right with them. You can just agree with them. So this is called always, always, always. It says things like don't argue, don't correct, always go along with them, reminisce with them instead. So this is a nice thing to have. And I'll put that by the front door there. So what we want to do is not take these changes that are happening to this person personally. They're not able to help it. My mother was suffering from Alzheimer's, and her personality changed. I first took it personally because I didn't know what was going on, but then I learned, and as a result, I was able to go with the flow, just, kind of accept whatever she said and be able to keep her happy and interested and, functioning within the family to the best of our ability. So we try to say it's the disease, it's not them. So here is a nice thing when it comes to if you do interact with somebody as you suspect that they're having some cognitive issues. You might introduce yourself, approach the person, maybe even get down to the same level that they're at, get their attention, be able to talk slowly, make sure that they're understanding what you're saying, using short, simple words, a comforting tone. You're going to try to speak to them and make them not feel threatened. Allow enough time for the individual to respond, and this is where we were talking about the language issues. They might take another few beats to figure out the right word and then to be able to use it. Avoid interrupting them. Well, we don't want to do that anyway because it's impolite, but in this case, it's even more imperative in that we're giving the person time, we're giving them their dignity and allowing them to respond back to us. If any of you next week want to go through the dementia experience, we're coming back again next week, Miss Courtney and I, and we will be putting on equipment, and I'm not going to say what kind of equipment because I want to have it be a surprise, but one of the things that you'll see through this experience is that there are many distractions. When the person has dementia, they're being affected by all those noises that are around you. And so you have to be cognizant of that if you're trying to have a conversation with them, so that they would be able to communicate the best that you can with them. Increase the use of gestures, when it comes to emphasizing a point, or using nonverbal cues, leaning forward in your chair to show that you're interested in them, and being able to smile a lot. A lot of those body language communication techniques are very valuable. And of course, if you're in the family or you're taking care of somebody with any type of cognitive issues, we want to make sure that they're safe. We want to make sure that they are being fed and hydrated enough. The problem with short-term memory loss is sometimes people with cognitive issues forget that they ate just a moment ago, or they might forget to drink to keep hydrated. So that's definitely something of note. So if you are in the middle of a situation, and we just kind of throw this in as an extra because we do want you to be prepared if you ever do come across somebody that you think has dementia, what we want to do is we want to try to understand what that person is going through. I was dropping off some friends at Riverside Cafe a few months ago, and there was a woman that was standing in the middle of the parking lot, literally standing there, like where cars were coming. And I thought, uh-oh, this is not a good situation. So I approached her and I tried to, figure out what was going on with her. Well, her daughter had driven her to Riverside Cafe's parking lot, left her in there with the truck running, with a big dog in there, and had gone inside to do whatever. We didn't know, picking up food maybe, hanging out with their friends. So this woman was very confused. And so I tried to communicate with her in that very calm manner. And it turns out that we figured out that her daughter was actually inside the restaurant. So it took a moment, for her to become a little bit less anxious, because she was worried, where's my daughter? But as a result, it was a very unsafe situation for her to be in. And so it was of concern. So, eventually we called the police and made sure, that she was safe. If we're trying to redirect them, which means that we're trying to take them out of the moment, we're trying to distract them. This woman, she was becoming increasingly worried. I was trying to, ask her questions about the dog. Oh, is that your dog? Pretty dog, something to distract her. And we call that redirection. You can compliment them, you can ask them a question, so that might take the tone of, in this case, she was very agitated, down a few steps. If you're talking with somebody with dementia or related Alzheimer's or related dementias, and they start to argue with you, let it go. Just agree with them. We don't need to be right. And in this case, we can just say, oh, I'm so sorry, you're right. I used the wrong word. Just to make sure that, they're not taking offense at it. We're trying to be very careful of their feelings and also careful of their dignity. And if you think that they might have trouble making a decision, what we might want to do then is to give them simple choices. Let's say you're at a restaurant, you might just say, do you want the chicken or the beef? Instead of giving them complex, and make the choices as simple as possible. So those are the 10 different those are the 10 different symptoms of what might be old age related. Aging actually is not that bad a thing. Our vocabulary is bigger, we have more experiences, we're better at decision making, but those are the normal things versus the Alzheimer's and dementia related. You can see they're very distinct. Does anybody have any questions? Yes?
I have a question.
Mm-hmm.
You were talking about when people forget somebody's name after they do.
Mm-hmm.
How much of that, this is me personally, how much of that has to do with effort? When I was in sales, I remember every single person's name, and then when I retired, I really didn't do it.
Well,
I wanted them to know my name, but I forgot.
Exactly. So we have something called the AM principle that we teach in that class, the total memory workout. It means if this is important to you, to remember this piece of information, you have to stop and you have to pay attention. You have to focus on it, and then you have to have some meaning. You have to give it some meaning and say, this is important for me to remember. And just like what you said, if it was part of your livelihood where you're trying to, tell somebody about selling something, that's important. And now you're retired, it's probably not so important, so you don't give it as much value, you don't put as much effort into it. So that's exactly the key to remembering people's names. It's not the memory, it's the amount of work that you do in trying to remember that piece of information. Very good, yes?
You've been saying that Alzheimer's is just one type of dementia.
Yes.
Okay? Is it the worst type, and what are other types of dementia?
It is definitely not the worst type. It is the most common type. Of all dementias that are out in society, the disease of Alzheimer is 70 to 80% of the cause. But there's over 100 other types of causes. There could be, there's one called frontotemporal dementia, and that affects your front personality, your cognitive. That is the most common type of dementia for women under 60, for example. That one we don't hear that much about, but it's probably going to be more prevalent. There's also a type of dementia that comes to only 30% of the people that get Parkinson's, but it is one that we hear about more and more because more and more people are getting Parkinson's. It's called Lewy body dementia. But then there's a whole myriad of other things like a car crash, a stroke, an aneurysm, maybe having surgery and being under the anesthesia longer than than is ideal, having multiple surgeries with multiple anesthesia, having a bad infection. So there's a lot of different things that can cause it. We just kind of use the word Alzheimer's because it is the most common cause.
What drug company is coming up with the bill, do you know?
There are a few drug companies that are coming up with some things that they think are going to help, yes. I don't usually speak about any of those because, in our mind, we're just not sure of what is going to become more promising. A lot of these diseases, though, because you're asking about specifics, is that there is an issue with their brain and proteins that are in their brain fluid that are not flushed out like they're supposed to at night. And as a result, we've got this, like pollution going on. With different diseases, it's caused by different things, but that's basically what's happening is that your neurons aren't able to communicate, and as a result, now you have this cognitive impairment. Anyone else? Oh, yes.
You mentioned changes that take place.
Mm-hmm.
Do they take place all at the same time, or do you just have one change and firing at different
Yes.
periods?
You actually might have multiple of these changes happening. Yes. It could be very quick. Some of these diseases, Lewy body or frontotemporal, there could be a very short amount of time, maybe 4 or 5 years, and that's why I said that Alzheimer's is the most common, but it is very different in that it takes 15, 20 years, and as a result, the person might be showing multiple of these 10 different symptoms.
There seems to be a fine line between age-related and changes.
It's a matter of degree. It's a matter of degree, right. And usually the people that are noticing these changes are the family. Maybe they just think, they're forgetting things a lot. But then when they start to look at the cumulative of these different symptoms, they might think, we should probably go to the doctor and get it checked out.
What are some of the activities you can do with a person
Mm-hmm.
who you think is becoming too forgetful?
Well, I would say for everyone, keeping a lot of mental activity in terms of, playing word games or doing, absolutely, bridge, learning a new language, learning a new dance, Anything that keeps our brains from, just doing the normal everyday things. We want to challenge our brains. That's another thing that we talk about in the total memory workout is we look at 10 lifestyle factors, things like getting enough sleep, having a good diet, being able to have a lot of mental activity. Absolutely, all of those things are very good for us to keep our brain engaged. Now that doesn't mean it's going to prevent them from getting dementia, but it's going to make their brain more exercised, so it's definitely good for them. Anyone else?
Just a little more.
Sure.
You mentioned the CAT scan.
Mm-hmm.
I know that's medical, but what are they trying to search for when they do a CAT scan or an MRI?
And it's different from any type of condition that they're looking for. With a lot of these diseases, they're looking for empty space. The brain might change, and it might have less connective tissue, and also, like more air in the brain. So it's not a one-all be-all that they can tell. It's more a progression over time that they would like do a baseline and then be able to look at it again later on just to see how the brain is changing.
Is that what they mean by an airhead?
It's actually quite dramatic if you look at the brain of a normal person and the brain of somebody with Alzheimer's or other dementias, is that there's a lot of empty space in there. So that's obviously quite hard for them to live a normal life. Yes. But we look forward, in case any of you are interested in next week, this dementia experience that I talked about. If you want to experience a little bit more about what it is to feel like you have dementia. Any other questions? Okay, thank you.